So getting started, so the Honors Bachelor of Healthcare Technology Management, we all have some interaction with it at this point. I can see that all of you that are joined here have either applied to the degree or you're interested in the degree and you've contacted us previously. So as you all know, it is Durham College's first degree. It is a 4-year honors degree. And so I'm going to just intro Rick here, who you've met, and then we can get started and he can kind of explain a little more in depth than I'm doing. So Rick Tidman, he is a professor with the School of Science and Engineering Technology and the program coordinator for the Honors Bachelor of Healthcare Technology Management and the 3-year Biomedical Engineering Technology program. Rick has over 35 years of experience in the healthcare technology field, and he is the driving force for the creation of the Healthcare Technology Management degree, which is the first of its kind in Canada. He, from his experience and wealth of in-depth knowledge that has allowed Rick to understand the rapidly changing healthcare technology field and the gaps that existed and why this degree is so vital to the future of healthcare in Canada, but also globally. So this is going to be kind of a Q&A style, so I'm going to ask Rick some questions, I'm going to ask our industry partners some questions, and then we're going to hear what, from their perspectives, is great about the degree, great about the healthcare technology field, and other things along that line. So to intro our industry partner, Gary Ryan, he is the former Chief Innovation Officer at South Lake Regional Health Center and from 2013 until his retirement this past year in 2018. In that role, Gary was the research/innovation department. He worked within that finding and testing new healthcare technologies at Create It Now, South Lake's healthcare incubator. Prior to that, Gary has had a lot of previous experience in the range of positions, including Chief Operating Officer, Vice President of Acute Services, and Director of Paramedical Services. He's held a couple of other positions. He is a graduate of McGill University with a Bachelor of Science in Physiology. He also has a Master's of Speech-Language Pathology from the University of Toronto, and in 2001 he completed his Master's of Business Administration from the University of Toronto as well. So, getting right into it, first up, Rick, what is healthcare technology management?
Welcome, everybody. So, healthcare technology management are healthcare's newest professional. So, the HCTM as a professional has emerged to fill a missing and identifiable gap in the wake of new and innovative medical device technology. So, healthcare technology managers are knowledge workers. They are functional specialists with unique skills to manage healthcare's transformation to an organization that is dependent on medical device technology. So we fill an ever-widening knowledge gap between sophisticated medical device technology, the user, and decision makers across the organization. So why is this? So our current collection of medical professionals are not well equipped with either the knowledge or experience to make informed and holistic decisions about new and innovative medical device technology. So healthcare technology managers take on a holistic approach to technology management, including but not exclusive to technology assessment, strategic planning, lifecycle management, department management, and the entire set of support decisions around medical device technology. So we are interdisciplinary specialists in the life sciences, business processes, and possess a deep understanding of medical device technology. We are visionaries. We implement and strategically plan for the organization's investment in medical technology to find solutions for the organization's clinical objectives and more broadly, the lens. So we are visionaries that implement current and innovative medical device technologies. We have a holistic understanding of the organization from a technology perspective. Our view begins at the point of care and moves up from the clinical service to the organization to the LIN and beyond from the province and perhaps even country in the future. So we are leaders that will guide the transformation of the organization to optimize the technology to deliver better care. So future advancements in health outcomes will come from technology to improve the diagnosis, monitoring, treatment, and intervention. And healthcare technology managers are healthcare's future leaders and will eventually move on to someday achieve a master's or a PhD and something that is even hard to predict beyond that, maybe some kind of combination of an HCTM MD. So we'll go on to our Next slide, in technology and medicine. So future health outcomes will go up, wait times will go down, length of stay will go down, and efficiencies will improve because of healthcare technology management. Technology will transform and revolutionize current practices and job responsibilities. Technology will lead to personalized delivery of care based on a patient's genomes and customized medicine. Technologies will shift our understanding from data to concepts and principles through AI embedded technology. Large data sets and artificial intelligence algorithms will uncover patterns and guide decision makers. AI embedded technologies in medicine will accelerate drug trials, and with AI embedded technologies there is a continual evolution of medical device technology, and we will never go backwards. It's all about technology leading healthcare into the future. So are we on to our next one?
So our next question is, what is the difference between the Bachelor's of Healthcare Technology Management here at Durham College and our 3-year Biomedical Engineering Technology program also here at Durham College? It's been a question that's come up a couple times from a couple of different students trying to understand really what does make that difference between the two.
So in the background of the slide, you can kind of see an iceberg back there. So in healthcare, 80% of the cost of technology is often hidden from the user and occurs during the lifespan of the technology, whereas what you can see kind of above that horizontal line usually represents just the capital cost. So to healthcare, the cost of technology is usually, or for the most part, managed by the healthcare technology manager or the biomedical engineer. So Durham College's HCTM program of study prepares the student who is seeking a leadership role. There is an emphasis on interdisciplinary studies, and unique to the HCTM degree are courses in economics, financial management, quantitative methods in healthcare management, the Canadian healthcare system process improvement, principles in marketing, and sales management. However, the fundamental difference between BMTY and HCTM is in the career trajectory. A BMETY may experience great job satisfaction answering user questions, providing service, calibration, maintenance of the organized medical device technology, and they will specialize but continue to provide technology service, whereas the HCTM, the healthcare technology manager, will begin by providing technology service but will progress to manage the work of the biomedical technologist, or going into industry or government or regulatory or LINs, but they take a higher level, long-term strategic view of technology. But as an example, if you were a healthcare technology manager in a hospital, you would direct the organization's strategic planning, you would optimize the organization's installed base, you would coordinate the purchase of new and innovative technologies to align with the organization's clinical objectives, and you will lead the transformation of a typical healthcare organization as new technologies enter and change the organizational structure.
Awesome. So moving on to question 3, what are some notable features of this program?
So our HCTM program is the first to recognize there's a transformation underway within healthcare and shifting towards technology. Durham College already is an existing market or industry leader with our BMTY program. And other notable features about the program, our HCTM program is interdisciplinary, that involves both business, life sciences, and medical device technology. We have a 420-hour placement period between the 5th and 6th semester, correct, I hope?
Yep.
Which will offer a variety of work settings so that as you move through the program, you may begin to like a certain area of HCTM, and hopefully through our placement you can kind of hone in on the area that you might want to find a career, whether that be within a hospital or regulatory or in government. And because the HCTM degree, our undergraduate degree, is at Durham College, we hope that you get the best of both worlds through college professors and university level professors who are able to take theory and provide practical examples how to apply that theory, which should give you a better holistic understanding of HCTM.
Awesome. So on the screen we have some pictures of the research aspects of the degree. So this is from our third years. Rick, do you want to explain a little bit more about the pictures that are happening on screen?
Yeah, this is a research project that has gone on for a few years now, where we have students from a variety of different schools within Durham College and also some of the disciplines at UIT. And we've developed a headset that we can non-invasively capture vital signs for a patient to, in real time, transmit from our patient to our primary care physician or whoever's monitoring our patient, regardless of location between the two of them. So our patient, you can see here, is a geriatric patient who can resume a normal life cycle or like normal life experiences. They can travel, they can stay at home, they don't have to continually go back in and be monitored. This headset that pops onto their ears is designed for an inverse mold that would go right into the ear, so it fit this particular patient perfectly. We can do that through 3D printing, where we can embed our sensors, and it's comfortable and it gives us a fairly clear real-time signals, and it just frees up this particular geriatric type patient to resume their life as they would hope to, and they can be monitored in real time anywhere.
Awesome. And then on this slide are some other notable features. So I can explain the pictures here. On the top left picture is a picture of our global classroom in its current state. So students in this degree will be using the global classroom for their first year Intro to Healthcare Technology Management course. Rick, do you want to explain a little bit about what you're planning on doing with having that global classroom access with this course?
Okay, so under the World Health Organization, poor health outcomes have been identified, or the leading cause of poor outcomes have been identified by access to medical device technology, so not access to clinical professionals. So we hope to eventually be able to deliver our entire HCTM program through the global classroom, through a global learner, regardless of location. So we hope that students from anywhere in the world can join in on the classes without having to move to Oshawa, because we can have the greatest impact on health outcomes by delivering knowledge to a learner in an under-resourced setting where they can have a huge impact on on the patients or the people who need care the most in their areas. So the only way we can do it is to use information and communication technologies so that we can deliver a fully enriched program of study to a new learner anywhere, and we can do that through our global classroom.
Mm-hmm. And then our second picture here, this nice shiny building, is our brand new Center for Collaborative Education, which the global classroom will actually be moving into. So it won't look like this screen anymore. It's a classroom with an entire wall of computer screens, and it's super interactive, where somebody across the world could raise their hand if they're in your lecture with you, and the professor will be able to address them right there in real time. So it's really interesting having those aspects at Durham College and be able to have access to that technology for your learning. And the final picture at the bottom here is the AI Hub. So that is also fairly new here at Durham College, and it's something that students are able to take advantage of. We are at the front of the pack leading AI technology and leading AI research. So it is something that's really nice to have at Durham College, is having this area that's dedicated to research in that particular field. Another thing that is not pictured here but is notable to note about the program is Oshawa's teaching city status. So starting last year, it's just over a year now, Oshawa has become a teaching city, so students are able to apply what they learn where they live. We are really interested to see how over the course of the next 4 years the degree is going to be able to play into that, interact with that teaching city, see how they're able to apply what they're learning in this honors bachelor degree where they live. We're going to just progress forward a little, just keeping in mind the time, to our next question, which is, what will my career be in this degree? So this is a big question that often comes up. What is healthcare technology management, and what is a career in healthcare technology management? So talking both within 6 months of graduating, also within 5 years of your graduation, 10 years of your graduation, do you have some examples, Rick, that you'd like to provide?
Yeah, I think, we first exit the degree, and you would gain experience, probably in field service, in an area of your choice, really. And after a few years of that, you would, well, your long-term trajectory would be for management. So if you were happen to work in a hospital in a typical biomedical engineering department, you would move up into the manager of that department, and in the years to come, you would probably move up into some kind of chief technology officer. That might not be the right term we would use in the years to come. It would be in healthcare technology management, but you would move up within the hierarchy in that way. You would still have to start as a service person, but your plans and your skills and your interdisciplinary skills would allow you to move up and use your soft skills up higher within the hierarchy.
Awesome. So this question is also a very good segue into our industry partner. So we're going to, so this is just an image of how the Bachelor of Healthcare Technology Management is right in that gap right now between the past and the future of healthcare technology, and kind of nice visual for that aspect. Moving forward though, so back to Gary Ryan, our industry partner for this webinar. So as I mentioned before, Gary was the Chief Innovation Officer at Southlake Regional Center, or Health Center, until just recently. So we're going to have Gary just provide a little more information about himself and see if we can learn about him, and then we have some questions for him.
Hi there. Do you hear me well? Can you hear me?
Yep, we're good.
Okay. Just wanted to check, make sure it wasn't working a little bit earlier. Yeah, so I've had a number of different jobs over the course of my career, including running the small rural hospital in Alliston for a period of time, and also running a very large community hospital in Newmarket, Southlake Regional Health Center, as the chief operating officer. But probably the job that is most applicable to the degrees we're talking about today was my last position as the chief innovation officer. And just give you one example of one of the projects we did, because it did involve the biomedical engineering department at Southlake, and kind of illustrates kind of the types of opportunities that Rick has mentioned are going to appear in the coming years as technology takes on a larger and larger focus in healthcare. So there was a researcher at UIT, just down the road from Durham College, who was very, very interested in the fact that in the pediatric ICU, all those little neonatal babies are hooked up to all kinds of medical equipment. So you're getting constant readings of their heart rate, their respiration, and so on. But a clinician, a physician, only shows up pretty much every 4 hours or so and takes a quick look, talks to the nurses, and checks in on the patient. So they're only getting a snapshot of the data every 4 hours. And then at that snapshot, they're trying to make a decision. Does the baby look like it's getting better, or is it showing signs of getting worse and maybe getting an infection? And a very serious infection is called sepsis, which can be very, very catastrophic for a neonatal infant who has a very low birth weight, because once an infection starts in that child, it can go very, very quickly. And if you don't give them penicillin quickly enough, the baby can pass away. So what this researcher realized is that there's so much data being produced by these monitoring machines that are constantly taking data all the time, that there's got to be a way to create algorithms where the actually machine learning, artificial intelligence, can take a look at all the data and predict whether the course of the respiration, the course of the heartbeat is such that it's indicating that maybe an infection is starting. And she has been able to get an algorithm which can predict sepsis 24 hours in advance of when a clinician can actually notice it in person. So that can be life or death for a lot of these children. And what she wants to do now is push her methodology further to try to get that predictability to be even longer than 24 hours, even as much as potentially 48 hours. So she started her testing and her research at Hospital for Sick Children a number of years ago, but needed more locations to get more data. And Southlake became one of her locations recently. And so we had to engage our biomedical engineering department, because what we had to do was not only make sure that all of our machines would feed into the algorithms she developed, we also had to work with biomedical engineering to figure out how to transfer that data to her research facility at UIT, how much bandwidth was required, how quickly it had to be captured, what would happen if there was an alert that came up, how would that alert system then get triggered back to our clinicians to potentially act on it. So that was a very important project for us, and the software that she's developing, once she commercializes it in the next few years, could be quite revolutionary for the treatment of neonatal infants, and could be a feature that is pretty much predominant in all neonatal facilities in North America and across the world. So that relied a lot on the expertise of our biomedical engineering department to figure out how we would capture the data, how to make sure the data was put forward in a format that could work with her particular algorithms, and then how to transmit all that data successfully with our current internet capacity. So those are the kind of projects that I was responsible for at Southlake over the last number of years, and it just kind of illustrates a little bit the kind of technologies that are going to become much more prevalent, as Rick said, in the future. That example I just gave was one where it's an in-hospital type of software program, but we also were involved in a lot of software projects which involved telemedicine, taking data from people at home and trying to feed it to our clinics so that they would be able to help know when a patient should come back to hospital to have their pacemaker reviewed or checked, or if their pacemaker was showing any signs of malfunctioning. So those kind of telemedicine applications are also on the rise. So as Rick mentioned earlier, a lot of healthcare in the future is going to be done remotely. A lot of it's not going to involve a hospital stay as much as it'll have a hospital as the hub of a whole series of technology, programs, hardware, software, artificial intelligence, etc., that will allow clinicians to be able to monitor a large group of patients, but not necessarily have to have them in hospital, having a long length of stay in a hospital bed where most of the time you spend just lying around waiting for someone to come and take your blood or give a little test to you. It would be a lot more convenient and a lot less expensive for people to be at home and to be remotely monitored. So I'll perhaps stop there and pass it on to Sam for the next part of the agenda.
Hi, Gary. Hi, Gary. So you answered quite a few of our questions we actually have coming up on the slideshow, so I'm just going to briefly go through them a little bit. If you have more to add when the question comes up, then we can stop and let you talk.
Okay.
So our first question was, what were your day-to-day and long-term tasks, which you did just explain, but if there's anything that we missed in that explanation, feel free to jump in here and you can add something.
Yeah, no, the two examples I gave, the telemedicine and the monitoring of neonates for their potential for sepsis, that was very typical of a day-to-day for me. I would meet different companies, listen to their new technologies, how they would apply, and then see if Southlake was able to be a test site for them to help them advance their technology. So that was a pretty good description, but the other parts of the job did involve trying to get funding as well. A lot of the early stage companies or early entrepreneurs need financing in order to be able to afford to pay for the testing that's going to be required to get them to the next stage of development. So checking out their technology, seeing if we could help them, and then also seeing if there were grants or other funding sources that we could also refer them to.
Awesome. Okay, our next question was, is there something you wish you had known or a skill you should have had starting out in the healthcare technology management field? We're looking more if there was like a soft skill that you wanted, now that you're in the healthcare technology management field, was there something that you kind of wish you'd known about?
I guess two things. One is and I think Rick alluded to this, the fact that healthcare technology is really growing. Many years ago when I started in healthcare, everything was very separate. A machine that we used in healthcare didn't have all this computer knowledge in it. or this software associated. But now everything in healthcare, like an X-ray machine, for example, an X-ray would take a hard copy of your body and produce an X-ray film. But there wasn't a lot of digital computing or software with it. But now it's all digital. So a CAT scan, for example, it's all the computer that's the real power behind it, as opposed to the CAT scan itself. So the idea that IT used to be predominant in hospitals, and the software programs were kind of the driving force behind the health record and all that, and the medical equipment was quite separate. Now that's all kind of merging together. All the medical equipment has IT functionality to it. And so I guess in terms of an answer, in terms of what skill I wish I had a little bit more of, I would have liked to have known a lot more about the healthcare technology, the actual technology side of it a bit more, because I spent more time paying attention to the IT side of it. And now that they're merging together, it's getting a lot more complicated. So it would have been nice to have both sides of the coin a little bit more than I did. And then the other one, and it's in the course content of the program, is all the issue around health economics. It's not an area that when I started out we were paying too much attention to, but it's so important now because there's so many technology applications that are out there. Technology is way further ahead than the actual healthcare system. So a lot of the challenge in healthcare now is not the fact that we don't have enough technology. The real challenge is knowing which technology is the right technology that we can use in a cost-effective way. So the whole health economics part of healthcare, I think, is taking on a much larger role, and it's an area that I would have liked to have known a lot more about a lot earlier in my career.
That's a great point. Rick was actually just pointing that out to me too. He had a comment he wanted to make on that.
So hopefully our new degree graduates, our HCTM graduates, are able to fill in that missing link about being able to assess our current technologies, new and innovative technologies, and to be able to determine which ones and which order technologies can be replaced in some kind of priority sequence that will deliver better health outcomes, that are more efficient to the organization, that are selected in a sequence that will optimize the investment the organization makes in technology.
And then finally, our next two questions kind of pair together, and I'm going to give you, Gary and Rick, a chance to answer both of these. But how do you see this industry changing in the next 10 years, which you have touched on a bit? And then how will AI affect this industry? So I'm assuming the industry is definitely going to change because of AI, but how are you kind of synthesizing this, and what's the answer that you're coming up for this?
Yeah, so I would kind of, for the first question, how are things changing in the next 10 years, would kind of go back to the comments I made earlier, and that is the whole separation of medical devices were a quite separate thing from the IT department. I see that really coming together in the next decade or so, that every single medical device now is a computer. There's really no medical device I can think of that doesn't have some computer functionality to it, some software with it, some analytical applications to it. And that's where the real power is going to be in the future, is not just having a device that tracks how much your heart is beating or not, but that also has software with it that can then take that information and predict what your heart condition is going to be in the next month or so, and whether or not you're likely to have another heart attack or not, etc. So I do see that merging of IT and healthcare technology, medical devices, as being a very significant trend. And so whereas in most hospitals, biomedical engineering is quite separate from the IT department, I do see the two of them starting to work a lot more closely, and I would suggest that would come together even further. And I think what was kind of alluded to by Rick earlier is that although not a lot, but pretty much all hospitals that have chief technology officers, they're usually looking to the IT world for the chief technology officer. What I think Rick is alluding to is that that's not necessarily going to always be the case in the future, that in the future, health technology specialists will now also begin to compete for those same health chief technology officer positions because of the merging of the two fields. So that's one big trend. And then the second, as I mentioned earlier, is telemedicine is going to really take off in the next decade or so, I think. Hospitals will still remain, but their ability to outsource a lot of their activity to the telemedicine world, I think, will take on a real functional advantage for hospitals and for the government. There's so much time spent in hospital where the patient is there simply because we're trying to do tests on them, because we don't know what's going on. And so you sit in the bed for 5 days, and on day 1, they take your blood and they do some x-rays. On day 2, they have a theory as to what's going on, and so then they do some more tests. And day 3, they've come up with some answers. I think a lot of that's going to get pushed into the home environment or into doctors' offices where they can take a few of those diagnostic or telemedicine type tests and then send the information to the specialist at the hospital, who can then try to come up with some theories as to what's going on with you. But I think that that whole push out of the hospital for a lot of that diagnostic work will make a huge change to hospitals and how much they need their inpatient beds. And I do think also that then there'll be some treatments that'll also be removed from the hospital setting itself into more clinics and more physician offices. So I think those are a couple of big trends. And then the second question on the AI, yes, I do think that there will be, just as I gave that example of the researcher at UOIT who's trying to use artificial intelligence to figure out her algorithms on how to predict sepsis, I would think there'll be a lot more of those types of algorithms in healthcare. There's so much data now being collected on everyone. With the current technology, you can be tracking your heart rate continuously. You can be tracking breathing, et cetera, et cetera. With all that kind of data, there's no way to handle all that much data unless you have a very stable and very robust AI algorithm that can support all that data gathering. So we've only begun to, I think, touch the surface of how far AI can take us in terms of being able to assist with diagnosing and treating healthcare challenges.
Rick, do you want to comment on this?
Sure. So in addition to what Gary just said, I can see data flowing from the point of care to very large data sets, but not just within the organization or the clinic, but I can see that data flowing from the point of care everywhere across the province, across the country in real time, and that data can be used for large pattern recognition using AI, and the result will be the accuracy of the diagnosis will go up, treatments will become personalized, AI will provide a lot of those analytics now that are done by medical professionals, patients will recover quicker, and I just can see AI replacing a lot of existing capacity within the organization, and that the positive or the outcome of AI within healthcare will be all, I can see as all being positive, although there will be a lot of disruption within healthcare. AI, embedded technologies, and large data sets will lead to much better health outcomes. And I just really can see a transformation that's beginning, and that will accelerate.
Do you have any comments you want to make? Or I guess you did comment on the AI industry. So we're just going to move forward here just to talk about your admissions requirements, and then we'll give you a chance if you have any questions, anyone in the audience, any burning desire to know anything that we didn't cover, or if you have anything, we'll answer them just in a moment. So for admissions into our program, we require your Ontario Secondary School Diploma or mature student status, as well as 6 grade 12 U or M level courses with a combined minimum average of 65%, including grade 12 English at the U level, grade 12 U Math or grade 11 U Mathematics with a minimum of 70%, and grade 11 or grade 12 U Biology with a minimum of 60%. For those of you who have already gone to post-secondary, whether it be college or university, we will take those credits as well. So we'll require 6 post-secondary credits with a combined minimum average of 65%, including college or university English or communications courses, college or university math, and college or university biology with a minimum of 60%. We recommend you take a grade 12 physics. We recommend that you take a grade 12 chemistry. They're not required though. A big thing to emphasize with this degree is that it's designed so that when you're graduating high school, you're able to come into it immediately, assuming you have these admissions requirements. So we don't expect you to have knowledge about the healthcare technology industry already. We don't expect you to have knowledge of medical devices. We're here and we're going to teach you all that. That's why you're in this program. So just want to reiterate that point. And then on the financial aid side of things, so it has been a concern for a couple folks. Just how are you going to pay for your education? And it is a common issue that comes up, and it's something that a lot of folks will worry about. So there's a couple things that we want to just point out. For anyone who's been on campus already, which I believe most of you have attended an in-campus or on-campus event, you would have received a financial aid package in your swag bag that we gave you. So you can browse through that, and you can see all the resources that are there. But we also have our entrance award for $2,500. So as long as you successfully register in your courses in August, you'll end up getting this award. There's no minimum average, there's no write an essay requirement, it's just money for being in the program. This is something just because we recognize the cost of it, and it's also because we're celebrating our degree. So it's nice to have this entrance award. You'll never see the money either. It'll be put into your student account, so you're not going to be able to hold your $2,500 in your hand and be like, look at me with all my cash. That's just not something that'll be happening. Other financial aid resources is our bursaries and awards on campus. So if you log into your My Campus account, there is a section that you can fill out the financial aid portion. You can receive bursaries and awards. We always encourage students to do that. One of my fellow recruiters tells everyone to apply to everything they possibly can, because you never know what you'll end up getting. They have received some interesting awards, so definitely recommend that if you might have a slight potential to win that award, to apply to it. We also recommend that you apply to OSAP. Under the new rules, you might receive more money than you think. There are tons of grant money now available in OSAP. You don't have to take the loan anymore, so if you are worried about taking out loans, it's not a requirement. So you can definitely just take out the grants. And then there's also on-campus employment, so DC Works and summer employment, so it's our work-study program. That application is also on My Campus. If you have questions about that, feel free to contact financial aid, or you can contact myself, Samantha, and I can provide you with the information required for that. And then, is there any questions? Does anyone have any questions for Rick, for myself for admissions, or for Gary, our industry partner? You can type them into the little chat box on the bottom left-hand side of your screen. Questions, comments, inquiries, anything along the side. I'll give you about 5 minutes or so you can write out your questions, and then we can answer them for you. so we did receive a question. So Caroline sent this question. I'm just going to make sure it's okay to read it out. Caroline, do you want to just let me know if I can read it out to everyone? Yes, okay. So your question is, in a critical situation, what do we do with the results? Does it mean there will be an open market for people to buy equipment and keep at home? How do we handle an emergency situation without clinicians? So I'm going to let Rick answer first, and then I'll give Gary an opportunity to chime in.
Okay, so let me just read this one more time.
Yes.
So in a critical situation, what do we do with the results? Does it mean there will be an open market for people to buy equipment and keep at home? How do we handle an emergency situation without clinicians? So, healthcare technology managers, we are still in support of the clinical staff at the hospital. So our role is still going to be as a part of a team, as a team of people at the hospital, the allied healthcare team. So we do not make clinical decisions as healthcare technology managers. We support clinical professionals. So we align technology with what they see as necessary to fulfill a clinical specialty. And also your question about technology being in the home. So regardless of location where the technology is, if you're the healthcare technology manager at the hospital, you are responsible for any technology that the hospital or any clinical professional that's working on behalf of the hospital makes available to a patient to take home. So if that device goes to a patient's home, as the healthcare technology manager, you are responsible for going out there. So if there's something, maybe it's a home dialysis unit, you are responsible for the electrical supply, the water supply, or whatever is needed to support the device in the patient's home. So let me just read your question one more time. How do we handle emergency situations without clinicians? Well, there probably will always be clinicians who support you in any kind of decision. So if if there's a question that comes up or situation that comes up where the technology is maybe malfunctioning, not working correctly, and you know about it, you would always consult with a responsible clinical professional who has approved that technology for use on a patient. So you're always a part of the team. We would never make clinical decisions on our own. We always support clinical professionals.
Okay, I'm going to pass it over to Gary to answer if he has any comments he wants to add in. And then we have a couple more questions that have come up, so then we'll address those questions.
Yeah, thanks. So I think Rick's correct that really the key answer to the question here is that you're always part of a team, and no technology would be purchased by any hospital without a sense of how the technology will integrate into the activity of the team. So, for example, if you were doing some kind of home monitoring, you'd have to have some kind of a clinical team that would respond to an emergency situation, and the team would figure out how they're going to incorporate the technology into the workings of that clinic. So it could be, in the case of 24-hour teams where they have staff on 24 hours, that there might be someone on call who's a clinician who could answer a patient calling to say, suddenly my device is just alerted, what do I do? But in other cases, it could be that the teams agreed that any alert, the patient is supposed to come to the emergency department. So it would depend on how the team has organized the use of the technology. But Rick's right. In all cases, the technology would never be implemented in isolation of a clinical team, and it would integrate into how that team operates in any kind of emergency situation with or without the technology.
Hi, thanks for your answer, Gary. That was very informative. So we have a couple more questions, so I'm just gonna get to those. So Ashley asked, how would placements for this program work? Are we required to find our own? So placements in this program, we're going to assist you through the process of finding your field placement. Just like how it is out in the real world, we're not going to hand you a placement. You're going to have to apply for them still, but they're from a list or from resources that we would have already looked through and we kind of have that connection, so it won't be a cold open for you. We're going to have a nice warm introduction because they'll know who we are, and we'll be like, this student is applying for this placement. Do you have anything to add for that, Rick?
I think our placements will be available from coast to coast, so our placements won't necessarily just be local like a graduate from the diploma program. We're going to look further afield for placement opportunities.
Is there any places that you're hopefully going to partner with? I mean, we can't say for sure yet. It's still a little while away, but is there anyone that that's your goal for that's who we want to be with?
I think the local health integration networks would be a logical place for an HCTM to do their placement because it gives them an overarching view of the application of medical device technology, not only at the local level, but across multiple hospitals, and how the LIN is in support of specialization throughout their member hospitals to deliver care through the use of technology. So it's kind of a higher level view of the application of technology.
Awesome. And then we have one more question here, Kashmala. So can you please elaborate what kind of service roles would be expected as entry-level graduates? So I'm going to pass it off to Rick again.
Okay, so again, the more you know about the application of technology, the better you will be off in the years ahead to become the managers of the people who provide service and maintenance and calibration. So one of your first roles may be upon graduation, if you were to get a job in a hospital and as a biomedical engineering technologist, it would be to provide applications service or training relative to the technology. So you will get a lot of calls from users about technology, and maybe, one of your first roles would be to go out and understand what the user is asking you, maybe provide applications training, but to get to the point of care and provide base level service or base level maintenance or base level calibration. You would do that for a while, so you got to experience all the clinical areas across the hospital, and I think at that point you would be ready to move up within the hierarchy, but it'd be very important for you to get the experience at the point of care in all clinical areas across the hospital, so you understood the nuances of the clinical professionals in those areas and had a really good understanding of the technologies that they've become dependent on.
Awesome. So if there's any other questions, feel free to write those into the chat box there and we can address those. Keep in mind that there are no dumb questions, and if you're thinking it, tons of other people are also thinking it. So it might seem like a simple question, but feel free to type it in there and we can address it. You might get an answer that surprises you sometimes, so I definitely recommend you type in those questions. We'll give you a couple more minutes and then we can get towards wrapping up. Okay, so it doesn't look like there's any more questions. If you don't want to write your question in the main chat box, you're able to also send me a direct chat message here, or you can always email me. I'll put my information back up on the screen before we exit, but I have talked to all of you before, so you all should have my email. For wrapping up, I'm just going to give Gary an opportunity to make any final points, and then I'll give Rick an opportunity. We want to thank you, Gary, for joining us tonight, our first industry partner on our webinar summer series for Where the Jobs Are At. So thank you very much for joining us, providing information and insight from your experiences in the healthcare technology management field, especially with your position at South Lake Hospital. So I'm just going to unmute that.
So thanks very much for inviting me. I was pleased to be here, and it's going to be an exciting opportunity, I think, for people to get into healthcare technology management, and the whole field is going to be one of tremendous growth and huge opportunity. Healthcare is not the earliest industry to jump on board a lot of the new technologies, and so there's a bit of a lag effect in terms of healthcare because there's so many regulations and so much legislation to make sure that all applications are safe for patients. But now that the technology has advanced so far, I just see the huge opportunities to apply all this knowledge and information to healthcare in ways that we can only begin to imagine at this point in time.
Thank you for those words, Gary. Rick, do you have any final points you'd like to make?
Yeah, and again, thank you for joining us tonight. And I would just say that healthcare is beginning to experience a transformation that is being driven by medical device technology. And the future healthcare leaders will include healthcare technology managers to optimize the transformation that really is accelerating, and a future that is just unpredictable at the moment, other than knowing that technology is going to become more and more and more important to health outcomes, and the dependency on technology will again just become more and more. And so as healthcare technology managers, the leadership and the role that you can play in the future of healthcare is just one that is pivotal to the success of the futures in healthcare. So it's really an opportunity for a career that really has no end.
So I believe all of you have been on campus before, but if you want to come back to campus and pick another degree tour, we are going to be hosting degree tours. We have one coming up. We're going to book it for July 6th. It's a Friday at 2 p.m. So if any of you do want to come back onto campus, or if you have any lingering questions, we can definitely set up an appointment. I can chat with you over the phone or in person if you do want to come on campus yet again. But I think that's it. We're just going to be wrapping up. I'm just waiting to check something. So just bear with me for a moment. Okay, so that is it. So this is our first webinar in our summer series. So this is going to be the first of our 3. Our next one will be happening in mid-July. We'll have a different industry partner to give you a different aspect of the healthcare technology management field, and what careers exist out there and what the industry is like. So stay tuned for more information about that. I will email all of you so you can join in and learn more about the degree that you're going to be undertaking for the next 4 years. It is an exciting opportunity, providing industry partner access. And if any of you do have any questions for Rick or even for Gary, I can definitely try and put you in contact with them and get those answers for you. So if you do have any questions, feel free to stick around if there's something that you just want to chat about privately. Otherwise, you are free to go. Thank you for joining us all tonight.